Anything you want to say, any interesting, any doubts, any interesting thing you want to ask me? We have 10 more minutes. What is spurious diarrhea? We discussed spurious diarrhea or pseudo diarrhea. I told you in the beginning, one of the early classes, symptoms classes. No. Actually, spurious diarrhea, I don't know how many people remembered. Spurious or pseudo diarrhea is patients are actually having constipation. Can you come to the whiteboard, please? Can you show here? Okay, this is the descending colon. Okay, somebody has a constipation. Oh, constipation and this stool has become very hard like stones. This is a constipated colon. This is all constipated fecal matter. Okay, when patient is straining, patient is wanting to pass stools, he is straining on the commode. What happens is the liquid portion, which is still not hardened, they come and trickle down from the sides, and patient will have patient passes. Can you see this? Yes. Patient passes watery motions here. So this is secondary to the constipation actually. In fact, the patient has constipation and the water content of the upper portion, this proximal portion of the colon, they are trickling down from the sides, from the gaps, and patient has, whenever patient is going to pass stools, when he is straining, because it is so hard that it's not coming out. Sometimes even up till anus, they extend these balls, these fecal hard stony balls of the stool. They come and obstruct here, and you will pass only liquid watery motion. So patients come to you saying that I've got loose motion, I've got diarrhea. This is a common mistake even doctors do. So when they say what we do is we give antidiarrheals, and that will increase your constipation. So history is very important. What happened? Then you can feel the abdomen. You can feel the abdomen. Sometimes you can feel the loaded descending colon. You can feel like a mass in the left iliac fossa. If you palpate here or here, left iliac fossa, you can feel that loaded fecal mass. You'll get a typical. It's a very common thing. You can see in your daily patient. You just feel, press it here. You can feel that doughy feeling. You know, dough. Dough is roti banane ke time aata rehta na, that you put fingers in that dough, your fingers will dip down. The same feeling you will get here. If you get a doughy feeling of the descending colon, that is nothing but your fecal matter. So when the colon is loaded with fecal matter, you get that doughy feeling. Sometimes patient will say that I've got swelling here, and even we get confused as a student that there's a mass in the left iliac fossa. So in fact, that is loaded colon. So this is what is a pseudo diarrhea I was talking about. So these patients, if you give enema, treatment for pseudo diarrhea is enema, not antidiarrheals. That's a usual mistake we do. Treatment of pseudo diarrhea is enema. If you give enema, this hardened stool comes out and patient will pass 1 or 2 loose motion and he will be cured. Or sometimes the stool is so hard that even diarrhea doesn't help them. So sometimes we may have to finger evacuate. We put the finger in the rectum and try to slowly evacuate in a piecemeal so that the contents come down, and sometimes they may immediately pass the whole bulk of stool. So that is the pseudo diarrhea or spurious diarrhea. Any other questions are coming? Treatment of flatulence. Flatulence per se is not a disease. Well, it could be because of many reasons. If there is some bacterial infection in the intestine, they produce more gas. So flatulence can be because of diarrhea, because of constipation, because of diabetes also. You have flatulence. Flatulence, there are anti-flatulence medication like charcoal-related taca-diastase and charcoal-related tablets are there. But then you have to see what is the cause, what is the primary cause of flatulence. Gas is not a disease. As people say, I have gas, I've got gas problem. There's nothing like gas problem or gas disease. Gas can cause colic, colicky pain. Gas also, especially this splenic flexure. Actually, can you come here? Actually, splenic flexure, if you see this hepatic flexure, that is the on the right side, is little lower down compared to the splenic flexure. Splenic flexure of the colon goes little up and it takes acute bend. Usually, the gas sometimes get stuck here. People come to us saying that sudden pain in the left hypochondrium here, sudden severe pain coming and going. So this pain will go automatically. This is called gas colic. And this is a common site for gas colic is your splenic flexure, where little bit elevated angulated area, the gas gets stuck there because of the higher position. So this is called gas colic. The flatulence also can cause pain, what we call it, gas colic. Okay. Okay. If there are no questions, we'll close here today. Lactose intolerance. Lactose intolerance usually we see in children. Exact treatment, I forgot actually. Lactose intolerance, there is no specific treatment. I think should not give lactose related foodstuffs. More commonly seen in pediatric age group. I don't remember the treatment part of it. Okay. Thank you very much and good night. See you. Bye.